Hello, I'm Dan Boyd, Medical Director here at Lakeside Behavioral Health in Memphis, Tennessee. We wanted to bring you this interview series in order for you to get an inside look at what we're doing at Lakeside. We're excited to give you the opportunity to get to know some of our incredible providers, so let's jump into the interview.
Radwan, thanks for joining us, and I wonder if you would tell us about your addiction unit.
Where should I start? I wonder. Let me take you back to 40 years ago when I started in this field. We used to have patients with alcoholism and drug addiction come in for a 30-day program, a 60-day program. During that period of time, it became evident that addiction treatment requires an extended, structured setting that allows for the individual to essentially for his brain cells to heal, for the addiction and the cravings to decline before they can be reintroduced into the world. So that was the principle that guided us in the beginning, long time ago. This has changed a lot. This has changed a lot since then, and we are now at Lakeside reviving, if you wish, re-energizing this concept of the importance of extended structured treatment for to improve the chances of recovery.
And what are some of the things your unit, tell me about the levels of care, the milieu, tell me about your unit.
So basically in our program, we have reinvested in a continuum of care that starts with the patient coming in for detoxification treatment, largely medical monitoring and medication treatment, in order to allow them to ease off their chemical of dependency, to ease off of it without any medical complications. That's the detox phase. After that, they become involved in the actual recovery program, which is a set of group and individual counseling that focuses a lot on all the hardships of recovery, all the barriers to abstinence, the goals of treatment, which, by the way, this is the time I would emphasize that in our program, the goal is total abstinence. So all addictive medications have to be left behind. So that's the second phase, which is the residential phase. They are within a structured environment. They're medically stable now, but they are working on dealing with their cravings, dealing with the consequences of their addiction, and of course, all it takes to prevent relapse. That's the residential phase. Then the third phase they would go into an outpatient setting where we offer them a boarding environment. We offer them an apartment in which they can have a certain, freedom of movement while attending also a continuing structured program in the outpatient environment. That's also has yes.
Because when you say outpatient, I think you mean the partial hospitalization program.
Yeah, and what it is that when you move into the partial hospitalization program, you're moving into an environment where the patients that come in are senior patients, senior in their recovery time. They've been through it. They know a lot about it, and there's a lot to learn for our patients from that kind of environment. So that adds another dimension, if you wish, to the quality of the work we do in the partial hospitalization program, as you stated. The last phase would be the intensive outpatient program, where they go down to a less intense frequency of meetings and attendance with the same concepts still in process. So when I mentioned those phases, we're talking detox, residential, boarding, and partial hospitalization, and then IOP, intensive outpatient, where they can be at home and they can come from home. But even then, home does not have to be their original home if the original home is loaded with addiction. So they may have to move into a sober living type environment. Our staff also facilitates that.
And as you think about addictions and our patients struggle with addictions in the pandemic, what thoughts do you have there?
Well, the pandemic is obviously a once in a lifetime event that nevertheless, the social isolation and the excessive stress of all the restrictive measures that have to be taken all these things do promote relapse. They promote the use of substances, both to self-medicate your feelings of isolation or depression, as well as the fact that you're not supervised by you're isolated, so you feel you're free to dabble with your drug of choice, and that's definitely unfortunate, and it's a major promoter of relapse. Yes.
Mm-hmm. So your unit is a separate building, actually, your addiction unit from all the other units, isn't it?
It is, and the physical structure is very important for the integrity of the program. Mm-hmm. Our patients have to be separated from different types of mental health problems because they have to create their own little therapeutic community. The value system that we promote in our program that includes honesty, total coming clean with all the problems that your addiction has caused, enforcing the values of total abstinence, of not self-medicating, but rather finding coping tools that are consistent with total abstinence. All these values are embodied in a therapeutic community. So when a patient of ours walks into the program, they're walking into an environment that's going to promote their commitment to recovery, that's going to try to break down their denial, because they're looking around, they're seeing everybody involved in a very honest endeavor here.
And I've noticed that can carry over when they go from your inpatient unit to your partial program, that sort of culture can carry over nicely.
Absolutely, it does, yes.
Well, we appreciate your leadership, and thanks for your interview today.
Thank you, Dr. Boyd. I appreciate you.
We hope you have found this informative. We know you have a choice in healthcare and hope you choose Lakeside.